80% of children with mental health conditions do not receive treatment. This is due to the stigma associated with mental health, the fact that treatment is not always considered as necessary as other forms of health care, and the lack of resources available. The stigma surrounding mental illnesses prevent children from getting the help that they need, but can be reduced through utilizing brain-based language, being aware of the warning signs, normalizing mental illness, and treating it like any other medical condition. One resource is the National Alliance on Mental Illness, or NAMI, which offers basic training courses to understand that mental illness is a medical condition. They also focus on using brain-based language when describing mental illness. Another source is the American Psychiatric Association, which provides a description of warning signs of mental illnesses to inform the present possible treatment options. There is also a nonprofit called Bringing Change to Mind, which is dedicated to normalizing mental illness by creating dialogues, raising awareness, and speaking out. "80% of people who have a mental illness do not receive treatment, which can impact multiple aspects of their lives. 90% of those who die from suicide experienced mental illness. 70% of youth in state and juvenile justice systems have a mental illness. 50% of students age 14 or older with mental health conditions drop out of high school. However, 90% of those who receive treatment have a reduction of symptoms and improved quality of life. Iowa ranks 47th for number of psychiatrists and 46th for number of psychologists, with less than 300 providers in the state. Information on where to find resources is needed for parents to seek treatment for their children. One resource is the Office of Consumer Affairs, which is a federally funded program in every state that can provide referrals for mental health conditions. Please Pass the Love is an Iowa-based organization dedicated to increasing school-based mental health through conferences and training for parents. The Mental Health and Disability Services, MHDS, is a division of the Iowa Department of Human Services that partially funds and coordinates mental health services. Be aware of the impact of untreated mental health conditions. Prioritize your child's mental health as you would any other medical ailment. Normalize mental health treatment and try to find the resources available to you.